probably see it back here. It's this machine, this robot, and it's a machine to treat cancer with radiation. It's based on robotic movement. It's got a head that produces radiation that moves around on the end of a robot, literally. CyberKnife has been around for a long time. By long, I mean, the mid-90s was when the very first version of CyberKnife came out. It was a neurosurgeon at Stanford University. He was using radiation to treat brain tumors. And he said, well, what if we could come up with this robotic thing that might be able to treat in a more precise way, a lot more flexibility. We'll use this image-guided stuff. And he kind of conceptualized this and got together with people at Stanford, some engineers, and they came out with the very first one. There have been countless number of studies that have been done with CyberKnife. It's not a brand new technology. It's a much better technology now. CyberKnife is excellent for small precision work. Generally speaking, you'd think, what size of tumor would be great for CyberKnife? Probably like golf ball size or smaller. That's where it really shines, and in part because it's using very, very thin beams. It's designed to work for very precise types tumors. If you have these kinds of tumors and they're near very sensitive structures, that's where you might go, boy, it's going to be worth it to try something like CyberKnife, because we're going to be able to sculpt right around this structure that we really don't want to hit, like the spinal cord. That's a very classic example where people have a metastasis in the spine. They need a lot of radiation dose to that. We know it'll do a great job, it'll get rid of the pain, but we don't want to hit that spinal cord, right? So we have to have that kind of, we talk about precision within a millimeter. CyberKnife works with a couple of x-rays that are 90 degrees from one another, all right? So what happens is if I have an x-ray like this, I have an x-ray like this, it gives me, roughly speaking, a 3D sense of where things are or should be, right? So I can tell for a given point where I need to go. And so CyberKnife takes these x-rays throughout the course of the treatment. So you may have like 100 or 200 beams that are delivered. And prior to every beam, you get an x-ray. That x-ray figures out where the location is of your tumor, or location we're treating, and makes an adjustment based on what it needs to do. So it says, well, you're moved over by 3 millimeters on this beam. The robot will actually move over 3 millimeters to compensate for that. CyberKnife, it just sounds so new and so different and whatever. It is the same standard solid principles of radiation that people have been using for decades now, except it's extremely well refined in how it's delivered. Most radiation forms we talk about with CyberKnife and with other kind of radiation machines, these are external radiation sources. So the radiation comes in from the outside and then goes into your body, and then the radiation converges where the tumor is. Okay, so it's an external thing. Brachytherapy is where you have little radiation sources, like little radiation seeds, and you actually literally put these seeds right inside where the tumor is. And so the radiation is actually coming outwards, right? Rather than from this way, now it's outwards. And it has a benefit that you don't have to pass through all the tissue on your way in. So if you're able to get these radioactive seeds right in the location of the tumor, then maybe you can spare a lot of the organs outside. With CyberKnife, we're able to get some very, very conformal doses that are distributed very nicely around the tumor in some very odd shapes sometimes, right? And a lot of times people would say, well, brachytherapy is maybe the gold standard in trying to get a dose distribution because you didn't have to have the radiation coming from outside. CyberKnife actually is able to emulate some of this brachytherapy type dose distributions for some cases. Basically, we have so many angles that the robot can send the beam in that we can, it's just simply a matter of being able to send in from all these different places, and that's what makes it able to conform very, very nicely. Recently, we were looking at a patient who had a tumor kind of sort of behind the eyes, right? A little bit back here. Question is, can we get radiation into that location without hitting the optic nerves, right? The eyes, the optic nerves, these things that You obviously don't want to have visual problems. External beam, regular radiation therapy, may have to take in the dose all the way around the eyes, right? So you can get this collateral damage. With CyberKnife, we're shooting a bunch of very small beams from all these different angles. So we can literally say, don't shoot a beam through the eyes. Don't shoot a beam through the optic nerves, right? Whatever optic structures that we're talking about, we say just literally avoid these. And so you get this really nice conformal plan that does a very, very good job with the tumor in terms of hitting the right dose. And these areas that you wanted to spare got virtually nothing. You might not know that when you're breathing, a tumor will move up and down mostly. And sometimes it'll move maybe like 3 or 4 centimeters, quite a bit over the course of a breath. So if I have a tumor that I'm trying to treat, my options can be a little bit limited. If there's going to be motion, I'm going to have to treat in anticipation of the entire motion. So I'm putting on a big margin, right? And I'm hitting a lot of lung. It engenders other problems. So the goal is to say, can I follow this? And CyberKnife has something called synchrony. So synchrony literally images where the tumor is and also images kind of a diode that's on your chest at the same time. And it makes this correlation between the tumor and where this diode is. And what happens is it's able to actually now follow in real time the motion. And so you might be breathing, shallow at the beginning of treatment. By the end of it, you're rapid or some other way or whatever. It adjusts and it creates this model on the fly. You'll actually watch the robot as it's pointing, trying to treat this tumor, and it'll move with your breathing. And as you speed up your breathing, it'll move faster. Lung tracking is a fantastic, is really, really solved well by CyberKnife. So if it's the case that you really, really want to have a high dose to the lung, and you don't want to hit any of the healthy lung tissue, it's hard to beat CyberKnife. I don't know of any other technology that comes close to it because of this tracking. When we're doing a prostate treatment, we want to be very, very careful that we don't hit the bladder, we don't hit the rectum. There's a lot of things that are packed in very closely. You're going to be able to get higher doses to that tumor or to the prostate because we can track it. Right? If we couldn't track it and we had to just make a larger, what we call margins to cover possible motion, we'd have to reduce our dose because of potential collateral damage. So when you can actually track it, when you're sure you're hitting what you want to be hitting, you can up the dose. And when you up the dose, you increase the chances that we're going to resolve that problem, that we're going to treat the tumor, treat the malignant tissue. Because we've got this precision, our side effects, our collateral damage is less. So then we up the dose. Sure, there's going to be a little more collateral damage, but we have more room now because we do have that greater precision. If it's executed properly, we actually should have equal or even potentially less side effects.